All right, today we're taking a deep dive into the herpes simplex virus. In this explainer, we're going to break down everything, how it works, what it does, and how it's managed, all in a really clear, visual way. Let's get into it.
So you've probably heard of these symptoms, right? Painful blisters, sores that just seem to show up again and again? Well, the culprit behind them is often the very same virus, herpes simplex, or HSV. But hold on. How can one virus cause problems in two totally different parts of the body? Let's break that down.
It all starts with understanding this key fact. While we talk about it as one virus, it's really a family with two distinct members, and they each kind of have their own turf.
So on one side, you've got herpes simplex virus type 1, or HSV1. This is the one most people think of when they hear cold sores or fever blisters. Then, on the other side, there's HSV2, which is the main cause of genital herpes. Seems pretty cut and dry, right? But, like with most things in medicine, there's a really important twist.
And here it is. This is absolutely critical to understand. Even though HSV1 prefers the mouth and HSV2 prefers the genital area, they are not locked into those locations. Because of oral genital contact, it's totally possible for HSV1 to cause a genital infection and, for HSV2 to cause an oral one. This crossover is a huge piece of the puzzle.
So, how does this virus become, a lifelong roommate in your body? It's all about its incredible and, frankly, pretty sneaky journey it takes right after that first infection. The whole process really happens in three main stages. First up, you have the primary infection. That's when the virus gets into the body, usually through a tiny break in the skin or mucous membranes. But it doesn't just hang out there. Nope. It then hitches a ride up the sensory nerves until it reaches a bundle of nerve cells called a ganglion. And that's where it pulls off its master plan, establishing latency. It basically goes dormant, like it's hibernating.
And check this out, the virus is incredibly specific about where it hides. HSV1, the oral type, usually heads for the trigeminal ganglion, which is the nerve center for the face. Meanwhile, HSV2, the genital type, makes its way to the sacral ganglion, down at the base of the spine. Once they get there, they can just chill out, latent, for life. And the reason they can do this is because these nerve ganglia are what we call immune-privileged sites. Think of them as safe houses, where the body's immune system patrols can't easily get in. It's a brilliant survival strategy for the virus.
But latent definitely doesn't mean gone forever. All sorts of things can trigger the virus to wake up, travel back down that same nerve it came up, and bam, you get the classic symptoms of an outbreak.
Okay, let's talk about oral herpes. The very first time someone gets it, which is often when they're a kid, it can actually be pretty rough. It can cause something called gingivostomatitis. We're talking fever and really painful ulcers all over the inside of the mouth. But later on in life, the reactivations are usually way milder. Things we all deal with like stress, getting sick, or even just too much sun can trigger those familiar little blisters or cold sores to pop up on the lips. They fill with fluid, then they pop, and eventually crust over and heal.
Now for genital herpes, it's a similar story. That first primary infection can be pretty intense with painful blisters and ulcers, and you might even have a fever and just feel generally lousy. The recurrent outbreaks, though, tend to be milder and don't last as long. But here's a super important point. Genital herpes caused by HSV2 tends to come back more often than oral herpes or even genital herpes caused by HSV1.
So, given how common this virus is, how did doctors actually confirm that's what's going on? And what can we do to manage the symptoms when they show up?
A lot of times, a doctor can diagnose it just by looking at the sores. But to be sure, there are tests. The gold standard today is a PCR test. It looks for the virus's DNA, and it's incredibly accurate. Then there's an older method called a T-Zank smear. A doctor takes a sample from a sore, puts it on a slide, and looks for these characteristic multinucleated giant cells. It's a telltale sign where the virus has caused infected cells to fuse together. It's a dead giveaway. You can also do a viral culture, but it's just not as sensitive as PCR.
Now for treatment. The main tools in the toolbox are antiviral medications like acyclovir and its cousins, valacyclovir and famciclovir. These drugs work really well to knock down the severity of an outbreak and help it go away faster, especially if you start taking them right away. But, and I cannot stress this enough, they are not a cure. The virus is still hiding out in those nerve ganglia for life. These medications are all about managing the active outbreaks.
Okay, so let's wrap this all up by focusing on the most practical stuff, how to prevent spreading the virus, and a final summary of the key things you really need to remember.
Prevention is pretty straightforward, but it just requires being aware. The number one rule is to avoid direct skin-to-skin contact with any active sores or blisters. Barrier protection, like condoms, can definitely lower the risk of transmission, but they're not foolproof because sores can sometimes be in areas a condom doesn't cover. And for people who get outbreaks really often, a doctor might suggest daily suppressive therapy, which means taking a low dose of an antiviral every day to help prevent outbreaks and reduce the chances of passing it on.
And this slide right here is the perfect little summary of the main differences. Let's run through it quick. Oral herpes, mainly HSV1, affects the mouth, comes back less often, and is usually spread by saliva. General herpes, mainly HSV2, affects the genitals, tends to come back more often, and is spread through sexual contact. This table is just a great mental checklist to keep the two straight in your head.
So, as we close out, I want to leave you with something to think about. What's the biggest myth or misconception about herpes that this just cleared up for you? Was it the fact that HSV1 and 2 can show up in unexpected places? Or maybe the fact that treatment is for managing symptoms, not for a cure? Really understanding these details is the absolute first step in replacing stigma with actual science. Thanks so much for watching.